My name is Madeline Sarver, and this is my patient Lucy. So I'm going to go ahead and start with her head. We're going to do her eyes. So from a distance, everything looks normal, symmetrical. The globes are in normal position and no obvious issues. So I'm going to move in and look at the conjunctiva on both the upper and lower lid. So it's normal, pink, and then we're also going to look at the sclera. It's normal, no abnormalities. And then moving on to the globe, we have the iris, the cornea, the anterior chamber, and pupil. So you can see the light reflecting off the cornea, looks normal. Everything else is, the pupils are symmetrical, no issues. And then we're gonna look at the third eyelid. So see that there, pink, normal. No abnormalities, and then I'm going to do the Menis response. So positive Menis response and positive palpebral reflex. Alright, so we're at the oral cavity. So gonna look, dentition's good. She's got some tartar on her canines. We'll look back, cheek, capillary refill time, it's less than 2 seconds. We'll look on the inside, the hard palate, pharyngeal region, and tongue. And then the sublingual region, so it's normal, no abnormalities. And then we're gonna look at the external ear. So her ear pinna is normal, no redness or swelling. I'm gonna check the smell. So there's mild odor, but otherwise looks pretty normal. And then, so I'm gonna move on to the lymph nodes now. So starting here, I'm going to feel both sides, check for symmetry. We have the mandibular lymph nodes. Okay, so those are both normal, small, smooth, symmetrical. Move on, go to the point of the shoulder and find the prescapular lymph nodes. Do both sides. Okay, feel those. Again, they're symmetrical, small, smooth. And then while she's standing, I'm going to do the popliteal lymph nodes. Okay. Okay, you can feel both those. They're symmetrical, normal. And then we'll put her in lateral and feel the axillary and inguinal lymph nodes.
She wants to go that way. She's just leaning.
Start here. Find the axillary. And not really finding those, but that is normal in this region if they're small and there's no issues. So I'm going to move on to the inguinal lymph nodes. Right there, and feel them pop. Those are normal, symmetrical. And then next, I will be doing the respiratory and cardiovascular system. So I'm going to start with respiratory. And so I'm going to break this into 4 quadrants on each side and then also listen to her trachea. Okay, so lungs sound good. She is panting, but otherwise lungs are clear. No abnormal sounds. So I'm going to move on and listen to the heart. So on the right side, we'll have the tricuspid valve. So I'll start over here now. Yeah, that's fine. So on this side, we have the pulmonary valve, which is in the third intercostal space. In the fourth intercostal space, we have the aortic valve, and in the fifth intercostal space, we have the the mitral valve. Also, when listening to the heart, you should feel the femoral pulse. Correct that. And then moving on, I'm going to do abdominal palpation. We start from the last rib. We have the cranial segment and start dorsal and move ventrally. So you should be able to feel the liver, the spleen, and sometimes the stomach. And in some cases, you can feel the caudal pole of the left kidney. And then moving back to the mid-abdomen, you should feel the small intestines. And again, moving from dorsal to ventral. And then finally, I'm going to switch to one hand for the caudal portion. And move again dorsal to ventral. You should feel the urinary bladder. And then I'm going to move on to evaluate proprioception in both front lungs and hind lungs. Start by supporting the trunk. Should have a quick response. She does. And the hind lung. Good there. And then the last thing, we'll put her into lateral recumbency and do the cranial joint test. So you'll find the tibial tuberosity and the fibular head, and then find the patella and femoral condyle. And so you're going to advance the tibia forward and check to see that the cranial cruciate ligament is intact. So keep this still and you'll move this forward, which hers is good. And I think that's all.